Good morning, everyone.
Good morning.
Thank you so much for being here. This is our special called meeting to adopt the budget today, to possibly adopt it. We feel confident through all of the study and through all of the staff and all the meetings that have been accomplished up until this day, that we have the information before us. We've had some more information before us today. We've had some to come in as far as Richmond, Virginia.
Yes, sir.
This more from Richmond to be here to make sure that we have all the information possible to make the right decision for the people of this county. So without further ado, we will begin with invocation. We'll ask Commissioner Pate if he will have our invocation, and then follow Pledge of Allegiance with Commissioner Joe Daugherty. Bill?
Thanks. Let's bow our heads, please. Dear Heavenly Father, as we meet today to perform the work of the people of Wayne County, please share both your love and wisdom with us. We know that your guidance on our path is part of your plan. While we may differ in opinion, help us remember that we have a common goal, and that being the welfare and the future of Wayne County. In Christ's name we pray. Amen. Amen.
Let's face the flag. I pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. We did go into 5:30 yesterday. I believe it was 5:30 or 6:30? 5:30. But we did go in a little late yesterday, or just a few items that we did not finish up that we wanted to get finished up before we got into, as what so many people have been anticipating, the school, the Wayne County school system, and where our budget stands with that. So with that, Mr. Smith, there were a few items that we wanted to finish up.
Yes, sir. If we could, before we get into budget, Ms. Chairman, may I ask Ms. Holt if she would come and let's go ahead kind of as the housekeeping today. These will be your final budget amendments of fiscal year 2012-2013. So I'd ask Ms. Holt if she would come up and walk through those, and you should have a package of those. And we do have some department managers here too that may be addressing some of these individuals. So I'll turn it over to Ms. Holt at this time, Ms. Chairman.
Good morning.
Good morning.
This morning, we're going to take them in numerical order, beginning with number 472. Number 472 is an increase to professional services non-per-share. This is additional money needed to get through the end of the year for professional services that have been hired by our audit firm, $340.
Mr. Chairman,
Mr. Daugherty.
I move adoption of 472 budget amendment.
Motion's on the floor to adopt number 472. Any discussion? All those in favor, raise your right hand. All those opposed? It's unanimous.
Number 473 is our solid waste department. They are asking to increase shop supplies and electricity. These are invoices that need to be paid for the end of the year. Appropriated fund balance, $514.
Mr. Chairman,
Mr. Mayor.
I make a motion to accept amendment number 473.
Motion's on the floor to approve number 473, solid waste. Any discussion? All those in favor, raise your right hand. All those opposed? That is unanimous.
Number 474 is a budget amendment to amend the grant for the State Employees Credit Union Foundation Public Internship Program. This is just moving the line items for the grant, decreasing salaries, and increases the workers' comp and supply line item. This is just to match the grant.
Mr. Chairman,
Yes, sir, Mr.
I move
Page.
that we accept Budget Amendment 474.
Motion's on the floor to accept 474. Any discussion? All those in favor, raise your right hand. All those opposed? It is unanimous. Thank you.
Number 475, Fire District, final one for the year. Our district payout, it is a total of $233,471.35. This is the cash that we were holding at the time of the budget amendment.
Mr. Aycock.
I make a motion that we accept this budget amendment.
Any discussion?
Mr. Chairman,
Mr. Daugherty.
just a quick reference to the amount here. This is over and beyond anticipated revenues in their budget. Am I correct?
Yes, sir.
And that total amount was,
$233,471.35, and that is every fire department's included on this budget amendment.
thank you, Mr. Chairman.
Any other discussion? All those in favor, raise your right hand. All those opposed? It is unanimous. Thank you.
Number 476 is a total of $59,629. This is the budget amendment to meet the payroll for the end of the year. These are the departments that were involved.
How much did you?
$59,629.
476.
We're showing that at 108.
We're showing another 180.
I mean, hang on, I've got an extra page in here. It is 108,944. I'd have an extra page in here.
Mr. Chairman,
Mr. Daugherty.
I move adoption of budget amendment 476.
Any discussion? I have one transfer to 622 for $49,000. What is the transfer?
Okay, this is the
622?
EMS transfer, and I'm going to let Joe Gurley talk about that part.
Thank you.
Good morning.
Morning, Joe.
I don't remember the exact date, but it's in April. We'll be coming for you with several payroll models for discussion to continue fluctuating work week, pay schedule at a different rate of straight rate, and to make sure that things transition smoothly. We chose May 12th as the date to make that transition. So what we've seen today is the May 12th to now payroll, which resulted in 5 weeks of the fluctuating overtime.
Does the 122, which is fluctuating overtime EMS, which is $43,350, does that follow in the same guidelines that you came up with these figures?
Yes, sir.
And is it under the same date, May 12th?
Yes, sir.
I did talk with the staff, with Joe's, and they did say that it was 5, this time it happened to have 5 weeks fall in it, so it did make it a little more than it would be on a 4-week basis. So they had actually 5 weeks fall in this pay period. So that did up it a little bit.
So then after May 12th, then of course this is on the GM's assistant.
Yes, sir. And one of the things that makes that go to 108 is it's a transfer, so you know, that shows up on both funds twice. So that is the difference in what I was quoting you the first time. You'll see the 49,315 in there twice.
Any other questions or comments? Mr. Aycock?
Yes, just clarification.
The board did approve this change in pay scale at either, April or May meeting. It's in April. I can't recall. It was either April 16th or April 2nd, board meeting day. It's one of those two.
I guess my question would be, was it anticipated if it were in April, and then this is May until now, June, and you've got nearly $100,000 there? Was that anticipated? When you,
Are you talking about EMS or total?
total?
Total is just small parts that, the main portion of it, like I said, the 108 is in there. You'll see the 49,315 in there because Fund 110 is giving it to 622. So you've got to do the budget amendment in 110 and also in 622. That is the only transfer that is a part of this. The rest of them are just small amounts that we need just to get through the very end of the year.
Okay.
There is like $4,825 that had to do with Wayne Net. And not only did I call EMS, I called Wayne Net when I had this, show up, and I began to question it when payroll hit this month. And we had discussion about it. And so the percentage change for Wayne Net, which has about 1/5 the employees that EMS does, the same percentage change was in both of them.
Was it a surprise or anticipated?
Yes, it's anticipated.
Anticipated.
Yes.
Okay.
I think we recall back to those meeting times in the previous 6 months about payroll and fluctuating overtime stuff. We addressed it for the employees, for recruitment and retention as well. And then we adopted on the May 12th because everybody agreed that would be the best cut over time and go ahead and address the problem as it was there at the time.
You said previous 6 months you're talking about.
From
July to December, or are you talking about from December 31?
December
For those-
31 till...
Those 4 months?
Yeah.
Okay, got it. Okay. Got it.
This is the first month we've had the true numbers.
Okay. Are we anticipating?
This is looking pretty good, because if you recall, we talked about fluctuating overtime. It's always referred to in Department of Labor as half rate, when really it's not half rate, as you've heard Mr. Smith say many times before. The more hours you work, it's diminishing returns. But looking at what we saw in the previous payroll is about a third of what it looked like today, and that kind of matches up to a third rate versus a half rate, what the comparison is. So it's standing pretty true. Now, however, in this year's budget, 13-14 that we're proposing to you, is still unknown to us because of so many variables there. As Pam said, it's the first true month of true history we're going to have go on. So it's going to take several months, maybe into a year, to get a good feel versus the way we were previously working with data from previous fiscal years.
We did go through a lot of scenarios, and we went through weeks and weeks of, and Mr. Aycock bringing us sheets of scenarios. And this is what we settled on in April. So as we go forward, still uncertain, I'm just trying to get a feel. Is it going to be $30,000, $40,000 budget amendments? Are these going to be $20,000 budget amendments? How are we going to get a feel?
I think, as Pam says, we go each month, we have to track it monthly, how it's going.
I tell you what I'd like to do is to analyze it at the end of the first quarter within the next fiscal year, and then not wait till the end when it all starts to begin to fall out, and it's a large dollar amount at that time. Since we don't have history, we have no history on this. So let us get through the first quarter, analyze it, and we'll come back with a budget amendment and report to y'all at that time.
Thank you.
And we're going to have to base it on weeks, on the quarter, because you can't do it by months, because some months we're going to have 5, some going to have 4. We have to do it on weeks for that quarter. And in addition to that, how many people have we lost? Have we had some to retire? Have we some go to other places? Other things that fits into the payroll as well.
Okay. Mr. Smith, any addition?
No, sir.
Are we okay then, going forward?
Well, I think they're right. There are unknowns. You've got to remember with Wayne Net, based on Joe customer base, additional customers, expansion of service, EMS is truly a demand service. So if we have incidents in more hours, the number's going to go up. So it is based on demand. So I think it is safe to say the number that you have budgeted will change, because we don't know. But as Joe and Pam both said, we tried to anticipate as best we could, but you can't be perfect. And I would say that the judgment of looking at the first quarter, see where we are, is the right move, and then go from there. I don't think that will make it perfect through the rest of the year, but I think that's the best steps you can take.
All right. Any other comments?
Mr. Chairman, I was just going to say, I agree with that after the first quarter, we'll take a look at it and see where we're headed.
Okay. All right. Any others? Okay. This is an action item, has to be voted on, and any other, before we vote, I'll do.
Mr. Chairman.
Yes, sir, Mr. Aycock. Mr. May, I'm sorry. Here we go again. Yesterday, I couldn't, and I'm on medication.
Yeah, we're going to get your name tags.
Switch places.
I'm just, I can't get my names right, I'm sorry.
Having been involved in this, as you know, from the start, one of my concerns is that we had a projected cost for this when we adopted it, and my concern is that we do whatever possible to stay close to what we projected it to be. One of the things that we talked about was that some of the part-time people we may not need as often when we went to this new pay system. Are any of those things, are there things in place yet to where we can make this number that we voted on and anticipated in the payroll increase more realistic? Are we doing some things to cut costs, in other words?
Yes, ideally, we look at it on a daily basis. Mr. Daugherty had mentioned some months back about using some type of, for lack of better words, a floater that we could have as a full-time person that would fill in for some of this part-time issues we have. But it is addressed on a daily issue of things that's going on. We try to monitor things as well.
Okay, thank you, Mr. Chairman.
Thank you, Mr. Mayo. Any other discussion? All those in favor of adopting this budget amendment, raise your right hand. All those opposed? It is unanimous. Thank you.
Number 478 is various line items that the health department needs before they get to the
477.
Sorry, 477, sales tax. This is where we are increasing the anticipated sales tax in the original budget that we moved from 110 to fund the school sales tax fund. We actually over collected on these articles, and so we need to increase the amount that we're moving to the schools. It's actually increasing $61,912.17.
Chairman,
Mr. Daugherty,
I move adoption of Budget Amendment 477.
motion's on the floor to adopt 477. Any discussion? All those in favor, raise your right hand. All those opposed? It's unanimous.
Number 478 is for the health department. It's increasing various line items by total of $3,100. This is to get them through the end of the year on these line items.
Mr. Chairman,
Mr. Payne?
I move that we accept Budget Amendment 478.
Motion's on the floor to accept Budget Amendment 478. Any questions? All those in favor, raise your right hand. All those opposed? It is unanimous.
Number 479 is for the WIC program for the Health Department. This is a grant program. It is increasing the other medical supply line item, decreasing travel by $500.
Chairman,
Mr. Aycock,
I make a motion that we adopt this budget amendment.
motions made by Mr. Aycock to approve this amendment 479. Any discussion? All those in favor, raise your right hand. All those opposed, and it's unanimous.
Okay, the last two were brought to me this morning by Mr. Milford Smith, and I'm going to let him come up and explain these two. Number 480, they're both for facilities. 480 is increasing maintenance and repairs, buildings and grounds, $100,000. And 481 is increasing janitorial supplies by $4,300.
Morning.
The $4,300 is for janitorial supplies. Our budget ran short when we added the senior center. It was not in last year's budget. Ran a little short there. The $100,000 is to make some, what I consider urgent repairs here at the courthouse, Borden Building and Jeffries Building. Really bad carpet issues are actually turning into a safety issue. Requesting that we take our 352 budget line and move $100,000 to 351, which is repairs to building.
The funds are in a different line item, but we're putting this before you because we're appropriating fund balance.
Mr. Chairman,
Mr. Mayo,
I recommend that we accept budget amendments number 480 and 481.
motion's on the floor to accept number 480 and 481. Any discussion? Yes, sir, I have a question on the 100,000, the budget amendment for this year, before we leave in a week. Has this work been done for this year?
No, we won't write POs. I've got the POs here. If you approve the change
Are
of the amendment, they will be done, yes.
are we close to have them done? Do you think we can have it done in 30 days?
Oh, absolutely.
Yeah, we're just encumbering the money with this.
Right.
So the funding, that's right, I should have known that you can't spend money without having it appropriated to begin with, but the budgeted amount, was it budgeted for next year? Are you advancing it? Are you trying to?
No. This is, as we're estimating our capital projects actually for next year, we're finding some of them running over. So we're going to need to find money. If I can do these needed repairs out of this year's budget, it's going to help my capital budget next year.
Right.
There will be a budget amendment that comes to you in July that will reappropriate, because these will be encumbered in this year. Those purchase orders carry forward, encumbering the fund balance next year. So you'll see it again where we reappropriate these funds next year for the purchase orders.
All right. Any other questions?
Just one thing. You've already gotten the bill on this. This is what it is to prepare this for.
Yeah, here's the POs here.
That's what I thought.
Yeah, he and I went through the purchase orders and requisitions this morning and all the pricing.
Okay, thank you.
The only price that's not in this package is the roof out at the Woods Maintenance Hangar, and that's in process. We've got a per square foot cost on that, so that 100,000 would include that.
And this is for the courthouse.
Courthouse, Jeffries Building, and Borden Building.
So it's the courthouse?
The atrium, the hallways, out in front of the elevators,
Yes.
that carpet looks,
Yes.
some of it's trip hazard.
Jeffries Building?
Same thing.
We're at in the Jeffries Building.
It's throughout the second and third floor in certain areas. especially the elevator, the common areas,
In the boarding building?
same thing. The only floor that's VCT there is the first floor. The other floors are all carpeted.
And the boarding building, the first floor?
It's VCT, it's fine.
Sir?
It's vinyl tile, it don't need new carpet, it don't have carpet in it.
So where are you spending the money in the boarding building?
The rest of the floors, all the other floors are carpeted.
And those floors are occupied by East Point?
3 of them are, 2 of them by social services.
Okay, thank you. Okay. Any other questions, comments? All those in favor of the motion, raise your hand. All those opposed? Unanimous. Thank you.
Thank you, sir.
And that's our budget amendments for today.
Thank you. Mr. Smith, that is the budget amendments
Sir.
for this day. Or would you like to continue?
Yesterday, I guess I'll kind of, we did have one item that was tabled till today, and there may be other items that you have for discussion in the annual budget prior to consideration, I assume, later this afternoon. But you did table the Arts Council. There was a motion yesterday to restore funding at $25,000, I believe, and that was tabled till today, so I assume there would need to be discussion this morning about that. That was the only open item that I've got note of at this time.
Mr. Chairman,
Mr. Daugherty.
I would show my ignorance here. How do I remove it from the table? I would ask that we bring back my motion to approve $25,000 funding for the Arts Council.
Okay, the motion's on the floor to approve $25,000 to be allocated to the Arts Council. Any questions? Comments? Mr. Pate.
I'd ask Mr. Dauber again, we're looking at the fund balance ahead, and would you explain that? Actually, that's not as large as it appears.
That is correct. Let me pull back let me find it here. If you will look on your sheets here in regards to the statement from the Arts Council, if I can find it. Yep, here it is. It's almost next to the last. You'll note that, again, the Wells Fargo investment account of $421,633.97 is actually funds in which the Arts Council went and got donations on to raise monies for their building fund. They then purchased the building on Ash Street, occupied it for a period of time, and then sold that building to the city for $500,000 and put it into this investment account. Now, they actually removed some of those funds for improvements to their existing site that they're currently renting. But those funds are restricted for the building that they anticipate acquiring at some point. Their actual balance of operating that they have in their fund is $15,031. So those are actual dollars that they have access to for operation. So you can see they do not have a large fund balance to cover their operating expenses. Does that answer your question?
Yes, sir. Thank you.
Any other comments or questions? The city of Goldsboro, the income from the city of Goldsboro, I have here $25,000, is that correct?
Yes.
And they're asking $25,000 from us.
Correct.
But I also see in their annual fund drive that they received $45,000.
In donations and, from fundraisers.
For a total income of $294,000. Of course, with that, they have business sponsorships, other grants at $20,000, restricted income $2,000, gallery income $10,000, art classes, $35,000. Are they selling the art? And is that where they receive the income from? It says art market, $16,000, but then it says art classes, $35,000. So are they selling the art at the classes, or are they charging for the classes and receiving the $35,000 from fees that they're charging?
Most of their stuff is free. They do have some classes they charge for, but the bulk of that, it is my recollection that it was from commissions on the sale of artwork. In some cases, we've had some of those here that they're just, and it may be $1,000 piece, and they get a percentage of that, so. The artists get so much, they get so much. As I remember in the discussion in the past with Ms. Merritt, the fees, most of their classes are free, that the fees they have for their courses sometimes just pays minimal cost of the class, but doesn't really make any money per se.
The classes, I guess as I studied it last night, I took it back, and that's one reason I asked to go back and table this, is when I looked at the salaries that were in their P&L, profit and loss statement, and their income from the annual fund drive, the city of Goldsboro, the Wayne County at $25,000. And then I saw where they have rental income at $12,000, but the art classes at $35,000, Mr. Smith, sort of stuck out. And then when I look over to the programs, I saw where it said classes, $22,000 for classes. And then, of course, the art market at $10,000. And then fundraising, $5,000. And then the grants, and then the gallery at $8,000. The artist payments for art sales at $5,000. Again, I guess I'm trying to find all of the revenues and how they're generating the revenues if they did not have the funding from the city or from the county. So are they actually making money, or people getting paid to do artwork, as we see behind us, and sell this artwork and fund it to become self-sustained, without having to use the funds? Do they need all of the 25? Do they need 10,000? If the market is good and sales are good and they're painting a lot of pictures and people are buying a lot of artwork, I guess my question is 25 too much, or is 25 not enough? They were just some of the questions I had. And of course, they do great things, and they're partnering with so many great people, like Center Stage Theater and the Goldsboro Ballet and the dance band and Third Century Singers. So many good things that they do. But I was just looking at the dollars. Any other comments or questions on this?
Mr. Chairman,
Mr. Cromartie.
may I ask Mr. Darty to repeat what he said about the $15,000? What was that comment? Was that what you said? That was
I just
what they
said
had?
that's basically what they've got left in their operating fund. Their day-to-day operating fund is $15,000.
So no matter how we add all these other figures up, it looks like they got $15,000 left to operate on it. Having said that, it looks like they may need for the escrow. That was the point I was getting at. Down to $15,000.
Any other questions, comments? Mr. Pate?
I got a note here beside the salaries. That's 3 full-time people out of that salary. Is that what that is?
They had the director, the person in charge of the art gallery, and then a office manager. So I would,
That's
yes,
right.
I think that is correct, that there are 3 persons. Mhm.
Doesn't look like it's exorbitant by any measure.
And then they get some assistance from volunteers to help with the gallery and, for other hours.
Mr. Chairman.
Yes, sir. Mr. Mayo?
Do you know, does anyone know, Mr. Smith, the history? I see on the sheet here in 2012, 2013 was 25. What was the 2011, 2012? In other words, what's the history of this?
I think we funded pretty level for a number of years. I'm just recalling, but she can pull the history, but my recollection's been fairly level.
Do you have that?
Since
Ms. Hope?
Yes, sir.
Okay.
Since '08. I use '08 because that's pre-recession.
Yeah.
'07, actually.
25,000 goes all the way back.
All the way back to 08?
25,000 goes 4 years ago. Let me see. I think I know that I have it.
One final question, Mr. Smith, would
Yes,
you know how many members they have? I do know I get an invitation each year to be a member and to pay in a donation. Would you know how many members they have?
I don't know. I don't remember I'm trying to remember on the fact sheet that they gave us. I don't think it listed total
I didn't-
membership. Do you
I
recall?
didn't-
I
I
don't
didn't
recall
see it.
that.
No, sir.
No, I can find that out, but
For the last 5 years, it's been 25,000, and that's as far back as we can go.
Okay. Thank you.
Question.
Mr. Pate?
Can you tell what kind of operating capital they've had over those years?
I don't have that with me.
Okay, that's fine. I just was curious if it had gone up or down or stayed pretty steady.
I don't have it.
I don't have any more questions. Any other questions? Comments?
how many members do you have of the Art Council?
Let's see if we can get an answer on membership.
Yeah.
They don't have members per se because they act on the issue of that there is no membership fee, but they have over 500 donors individually, and that it ranges from a few dollars up to thousands of dollars. She said that you remember the number's over 500.
When you purchase a building, just a comment, when you purchase a building and you sell that building, then if you've got a cash balance, that's because you did not go back to the building or to the savings and loan, and there's not many of those left, but to the bank and pay off the debt. Or somebody, some donor guaranteed the debt. And this didn't happen. There was no bank paid off, there was no loan, there was no liability. They sold the building, they put the money in,
They received the proceeds from that sale.
and they did not owe any money. And they have, what you just said, they have approximately 500 donors. Any other comments or questions? If not, all those in favor of the motion, raise your right hand. All those opposed? 6, 4, and 1 against. And I was the one against those who were listening by internet. Okay, anything else?
Looking at my notes from yesterday, and I don't remember any other open issues from yesterday. There were no other items left open. I think we'd answered all the questions. We had one question, Mr. Pate, we got that from WCDA.
Did we ever vote on that, though?
On WCDA?
No.
No, we didn't.
I don't
We
know.
didn't.
We got the information for it, but I
Yeah.
don't think you voted.
That was not an action item, unless the board wanted it to be an action item.
Yeah, because there were no other changes.
Okay, that's fine.
Yeah, it was just information.
I just thought about that.
Chairman's
I
correct.
thought about that after I got home last night.
Mhm. Yeah, so, Pat, can I ask a question, Mr. Chairman, with that 25,000, that was just change our, we had not incorporated.
Contingency is $625,990.
The total that we've been discussing goes to $625,990. We've been running a tally, and we were trying to get that correct last night, so. On your sheet, that second sheet in red, that would go 625,990.
6 what?
625,990.
All right.
You'll see that quarter of the way down, second
Yes.
page, in red.
And that right now is
Marked for contingency.
defined as, right now is marked as contingency.
To balance, yes, sir.
Okay, and Mr. Daugherty?
There are several other items on this sheet that we have not gone over.
Which sheet?
Well, the outside agency sheet.
Okay.
We were, I assume we were working off of that sheet yesterday. We were, as an example, Gateway, Capital Gateway Administration, Wayne County Firemen's Association, and WCDA. I mean, we did not acknowledge those, but there again, it may be that we have a motion just to approve all of those.
Yeah, because there were no other recommended changes. I mean, that's part of, we hadn't put them on a sheet because there were no other recommended changes from previous work sessions.
Well, I had some questions on Gateway, if I could.
Sure.
Go ahead, Mr. Daugherty.
Well, there are two items here under Gateway. One is Gateway Capital of $37,743, and then
Yes.
Gateway Administration. And speaking of fund balances and cash, they've got $327,000 in cash on those, and I would just inquire as to why we would be contributing those funds over to Gateway.
Well, they will be using what I consider to be a maximum amount of their fund balance this coming year by our going to the, our original recommendation was to give them a higher level and reduce use of fund balance in their area, because I do have some fear of what may occur. However, we do have a new director, as you know, and hopefully she can, kind of get things on the straight and narrow. But the dollar amounts we have in, I consider this to be minimum amounts, but they will be using, if the budget stays as is, they will be using a substantial amount of their fund balance from the rural side to move forward this year. They will be using several $100,000 of fund balance.
Can we get an idea in regards to, under Gateway, what their losses were for this last year?
Yeah,
Can we get an idea on that?
Yes.
Yeah, we talked about that. Yes, so can you go ahead and pull that?
Could we?
Yeah, because we discussed it, and
I mean, I think we need to know if they're
Sure.
losing at the rate of 200,000 a year or whatever.
and it was over 200,000 at one point, so, and in talking with Gateway, the numbers that we're giving them, they will use at least that or more this year. But our hope is that the new director will be able to look at some additional grants, state and federal grants that we are not accessing, and we understand that there are some that we are not, and that maybe we can draw those down and maybe help us on our bottom line, so. And reduce costs too, because we've talked about that efficiencies on the routes and things.
I'm just trying to find out how large of a sense of urgency we may have here of stopping the bleeding.
I would, if you asked me for a word, I would say it's critical,
Critical.
yes.
Mr. Chairman,
Mr. Cromartie.
I'd like to ask the question, when you say stop the bleeding, is that because of routes are not profitable?
Could be.
Is that because, when you say stop, do you think it's because routes are not profitable? Or what is it?
Well, let's first, we have an urban side and a rural side. So I'm taking the urban and moving over, that's what the city contributes to. So the rural side. The thing that we're finding is that our ridership is at an all-time high. I do think we have route efficiencies that need to be looked at. And that's part of the director's new initiatives to take a look at that. I also believe in interviewing directors from other counties, Ms. Holt and several others, that there are dollars that we are not drawing down, that we should be drawing down in the rural portion, and probably in the urban, but more from the rural side. So they're doing that. So the route efficiencies, reducing costs, I think there are things that they can do to reduce their costs at Gateway, and she's already examining those administratively. So I think that's the case. Also would like, if I can, Mr. Chairman, an LGC has contacted Gateway. I'd like the attorney, if he would, to mention that we have been contacted by the Local Government Commission.
LGC is concerned that they are dipping into their fund balance to balance their budget.
And that letter was received in the last 30 days.
Right. And apparently, when they get their funds from the state, there's been more and more of a delay in the money that they're supposed to be getting. And so they need a fairly large fund balance just to be able to operate.
For cash flow. And that's part of and Ms. Holt and I have had that concern for about 6 months, that they've got to have some cash flow there. If not, and I will tell you, when I arrived here 12 years ago, I remember early on the rural side, we actually had to send cash over just to help them cash flow. Because the state was delaying and the feds on the grants, and we had to help cash flow. And then we leveled off and did good for a number of years. Now we're going through this transition again with grants. And that's why we needed a new director that understands public transit, because it's going through major overhaul, both on the federal level, as you know, and on the state level.
Is there a percentage that's required on the fund balance?
On reserve, they have to meet the 8%. I mean, they have that 8% also rule.
They do?
Yeah, they fall under the same rules that we do on that.
They're a governmental agency.
Yes.
So they fall under the 8% also? I did not know that.
Yes.
Okay.
Mr. High can probably tell you a whole lot better than.
We'll save Mr. High for later. He's got much more to talk about. I'm just kidding.
I don't think my mic works.
No, you'll have, if you'll come over here, because
Which, where are we right now in relation to the percentage?
that I don't know.
I don't have the percentage here, but I can tell you that for the 12-13 year, they're anticipating using $186,990 in fund balance.
I'm sorry.
$186,990. I asked a few questions at the board meeting this week that I attended. Their unrestricted fund balance anticipated for June 30th, 2013 is $107,894.08. The question I asked are the revenues that you have in this estimated fund balance received? And the answer is no.
Yep.
They're accrued, and that is $70,000. If you take out the revenues that have been accrued or on a receivable instead of on a cash basis, then you're down to $37,000.
Yep. That's why I used the word critical.
So you said fund balance, you have $1,087,000. So how much
That
is
that includes capital, remember?
That's capital.
They're cutting very close.
Okay.
Mr.
Mr.
Chairman,
Daugherty.
Ms. Holt, I would ask that board look at converting over to a cash basis versus accrued basis. I mean, if they're going to show in their fund balance $70,000 of receivables, that doesn't truly give you a very good picture.
I agree, that's why I asked.
But
I wanted to know that question.
Well, my next question is this: if they're going to use $186,000 out of their fund balance and only have $35,000 of actual cash, how are they going to split those fishes and those loaves to get that?
I think they can make it for a while. They're hoping to turn it around. I did ask that the director come speak to you the first meeting in August. So she is going to come and present to y'all her plan for the next year. And I think that at that time, we can make it, till that time. And at that time, maybe as a board, once you hear her presentation, then there's going to have to be some decisions made how we move forward.
And we've anticipated, that's why in our original discussions, looking at the budget team, was if we intended for the rural portion of that system to look anything like it does today, even with trimming it back, I do think we'll wind up having to inject some cash into that system to keep it going.
All right. Question, are you going, this is for the finance director, are you anticipating any budget amendments prior to August 1st?
From Gateway?
Yes, ma'am.
No, sir.
Okay. I'd like to make a motion, entertain a motion, if the board would allow me. That we accept this request as indicated. And along with accepting this, that we have a full report at the first meeting in August by the director, the county manager. The county manager, I understand, hires the director by the county manager, because the administrative cost, I understand, comes under the county, and the individual is a county employee with all benefits.
Then reimburse.
They reimburse us.
And they reimburse us for that.
I understand. And along with that, bring the profit and loss statements from 08, 09, 10, and 11.
Okay.
And so the current board members will be aware of the past comments on Gateway, so it won't be found as a surprise. Go find the minutes that were brought up in 2010 and 11 on Gateway. Because I remember making the recommendation that we amputate. That's just a side note. But I want to make that as far as a motion. Any discussion? If there's no discussion, all those who approve the motion, raise your hand. All those who do not? It's unanimous. Okay.
Mr. Chairman,
Mr. Daugherty.
we can go now to nutrition for the elderly. I move that we accept the allocation of $65,000 to the nutrition for the elderly.
Motion's on the floor to accept. That motion for nutrition for the elderly. Any discussion? $65,000. It's mighty generous. That would be very nice. Any other comment?
Just a question.
Yes, sir, Mr. Pate?
Out there to the right-hand side, that our revenue expect grant or something, if it is reverted, what does that mean?
Say again, what sheet are you looking at, Shad?
There's an explanation sheet. I mean, are we getting reimbursed on a grant or something?
That's a grant, if they don't spend it, that's just that. That's what it means.
Okay.
That's the HCCBG, with the home community, we were talking the home community care block grant monies.
Okay.
Yeah. But
I
this
thought
dollar
that's what
amount
it
is the
was.
actual meals that then go to the congregate meal site. And home delivery. Mhm.
Motion's on the floor. Any other discussion? All those in favor, raise your right hand. All those opposed? That's unanimous. Thank you. Any others?
Mr. Chairman,
Mr. Daugherty?
I'd like some additional information on Watch in regards to our funding level in the past, and you're recommending $220,000 for Watch. And I'd like to get a little history on Watch, because as I recall, Watch was formulated and was later, we began contributions on Watch.
I can give you the last 5 years.
That'd be great.
Okay, 5 years ago, 101,564. 4 years ago, 101,564. 3 years ago, 101,564. 2 years ago, 120,000. Prior year, 220,000. This year, 220,000.
So if I'm correct in that, 3 years ago is what, 101, and we basically doubled that contribution?
3 years ago, you're at 101,564. 2 years ago, 120,000, which would be about an $18,500 increase. Then prior year was 220, which would have been $100,000.
And there were a couple things, that was the transition when Kate B., I think it was Kate B. Reynolds, I believe, I'm almost certain that it was, just trying to get back and recollect. Kate B. Reynolds will only supply a certain number of years, and they ended that, and that difference was 100,000, right, just over 100,000. The hospital put up an additional, the difference, and the county did. So both entities put up money to make up the difference of Kate B. Reynolds. And our part was right at 100,000. And the reason was for the hospital to keep people out of the ED, not selling, just saying this was part of the discussion. And the other was health department, just to keep our numbers down, because they see over 10,000 patients, of which we could not see additional 10,000 in our health department. No way. So that's why we did it. It was cheaper for us to do it than to see the patients. So the hospital put up money, we put up money, both about $100,000.
Mr. Mayor? Mr. Mayor?
Question, does the city put anything in this?
Well, let's see. It looks like I don't know if all the municipalities, because it's a countywide system. If other municipalities contribute, I'm not sure. I have seen in the past where some of the municipalities have given for like specific causes within Watch, an event or something. But I don't know that it's been regular. I do see, let's see. Do you have anything in their package that shows that?
Going to it right now.
Okay.
association, so I don't think I'm gonna have
Mhm.
the financials just for watch. It's a combined.
It's a
financial
combined, it's a
statement.
combined financial statement, so you have to pull it out, and that's why I was trying to, and I couldn't pull it. But I know there have been dollars given for events, but I don't think it's been a regular contribution from municipalities around the county. It's basically, when it was formed, it was the county, the hospital, the volunteer, the doctors, the foundation formed it. But yeah, we do have the clinic at the Y now, that was actually added, and that's really helped kind of curb some things in the area, so they have put in something at the Y, so.
Well, since this is double though, from basically what Commissioner Daughter's saying, from 120 to 220, I think it's time that we ask some other municipalities to contribute to this. Because we are providing the services, and, you know, I think a contribution from other municipalities would not be a bad thing. We need to ask if we're not asking.
I think this is Cicely Elmore, if I'm not mistaken. I know from at least Goldsboro, I think requests have been made in the past. Where they made this year, I'm not quite sure, but I know they've done it before, but we can talk to, you know, the watch board about that, because, you know, they do some pretty substantial fundraising every year.
Okay, my other question, Mr. Chairman, this is for Ms. Hope probably. The $571,000 that's cash, restricted and unrestricted, did you give us a breakdown on that, please?
Okay.
I think there's some explanations on that second sheet also.
Oh, is there?
Yeah, you'll see it says a paragraph behind there, says the attached balance sheet indicates total assets of $791,000. And then the amount restricted assets is $222,000. Operating expenses of $953,000 for 12/13. And that they must keep 3 to 6 months operating expense on hand, because remember, they are accredited. They are an accredited system, so they do have certain things that they have to
Okay,
make
I
sure.
got it.
And I think that's the best explanation right
Mhm.
there.
And I
Okay,
think we had
yeah.
asked the question, they included that.
Okay, thank you.
Sure.
Thank you, Mr. Chairman.
Mr. Chairman,
Mr. Daughtery.
I'll make a motion that we reduce the funding for watch down to $110,000.
From,
From the 220 to the 110.
Mr. Chairman.
motions on the floor to reduce the givings to watch from $220,000 that's been recommended to $110,000. Any discussion?
Yes, Mr. Chair.
Mr. Bell.
I'd like for Mr. Doherty to explain why you want to do that. I mean, did you hear Mr. Smith say that this watch program help us in the health department? It keeps people out of the emergency room and all kind of good deals that come out of that watch. We're dealing with people that the working poor that doesn't have insurance. That's what watch is all about. And but I can go along with it if you can explain to me why you want to cut it.
Mr. Chairman, my only comment to that was that the funding level of that was basically around $110,000. It was only recently that has gone up to the $220,000. They have a fund balance of $571,000 in cash. They certainly can sustain themselves, and I just feel like that we need to reduce that to the $110,000 level.
Any other comments?
I have a question.
Mr. Page.
If we do reduce that amount, is it going to impact our accreditation and ability to draw additional dollars?
Possibly. Yes, they're gonna, I mean, based on, and this is going back a couple years ago, based on level of service, grant commitment, because they do have grant commitments. It's gonna hit several areas. I think they're going to have to reduce service, because, you know, we have volunteers, but there's also some paid folks in that system. They're gonna have to make up this difference. The other thing is I do have some fear of, now, they were able to obtain, because they had asked for additional funds this year, but they were able to get this other grant, which enabled us to stay at level funding of 220. I think it puts the program, I mean, I'm not being critical, I'm just saying I think it puts the program in jeopardy of existence. And because some of those, when you get into like the Cape View Rentals, some of those foundations, they are very specific in what you said you would do in local commitment. And we would have to talk with Dr. Gaither and Sissy Lee and those folks to look at what the impacts would be. And you remember, well, some of you were there, the discussions there. I think it could jeopardize, I'm just telling you, I think it could jeopardize it, but it's a board decision.
Mr. Chair,
Mr. Daughtery.
did I understand you to say that basically by going back to the funding level of 3 years ago, that would jeopardize the entire program?
Yes.
And why again? Because they do in fact have over $500,000 in their fund balance. So they do have resources to pull back from.
They have some, but they don't have 500,000 that they can pull from, because some are restricted. What I'm telling you is you also have to look at when these grants come into the year, I'm trying to recollect now these discussions with Sissy Lee and Dr. Gaither. There are times of the years when these grants come in, so they have to cash flow at certain times of the year heavier. It's kind of like the county. You know, we get our money August, September, October, November, December, and then all of a sudden the money stops. So you live off what you collected in a certain time period. Well, they do the same thing on these foundations. So there are times of the years that they have to basically float part of the year. So I just think it's going to jeopardize level of service.
So if I could follow up on that.
Yes, sir, Mr.
And these are just my opinions based on discussions with them, so.
All right. At what funding level then are you saying that they would not be jeopardized?
220.
220,000, and anything less than that, they would jeopardize their mission?
Yes. Based on the discussions with Dr. Gaither and Sissy Lee with our team, yes. That's how I understood it. And all I can do is base it on the discussions I've had with them. That's what I understand.
Mr. Chairman, I withdraw my motion.
Mr. Chairman.
I understand you've withdrawn your motion. Mr. Daughtery.
I did.
Mr. Pate.
I understand what Mr. Daughtery is talking about, and that is quite a bit of money. But I know the deals to get out of it, but I think we should send a message to the other municipalities, like Mr. Mayo said, that they need to help out on this effort too. That the county can't stand alone and continue to do this every year. Thank you.
Mr. Chairman.
Mr. Mayo and Mr. Cromartie.
I was at the budget presentation when Watch came before us, and am I correct in saying that if I heard Dr. Gaither and some others talking, that the money that is funded and what Watch does, that if these same services were taken through our regular system, going through emergency room hospital, that, am I correct in saying that that would end up to be about $4 million? Was I correct on that?
$4.4 or $4.5 million is what they were quoting.
Now, how credible a figure is that, do you feel? Is it
Pretty credible, because some years ago when we looked at increasing our funding, we actually ran the numbers of the ED, they looked at the hospital, they're having to take people in the ED, but we also looked at if folks could get to the health department for certain care, and some of it we couldn't do because we don't offer full primary care service. But if there's some that we could offer, we could not do it at the rate that they could, because they got free pharmaceuticals, you donated, they got free physician care, all these things. Ours is paid, we have to pay for it. And And most of these folks are people that fall through that may not have certain abilities to pay. So it was going to be full cost for us. So I think it's a very credible figure, because we really challenged them years ago on what that number was. We really put them through the task on that. And I know it's a lot of, this is a lot of money. It is a lot of money. But I think it does help the ED, emergency department, and the health department in kind of offloading folks out of those systems at a lower rate of cost.
Mr. Chairman,
Mr. Mayo,
I want to make the motion that we leave the 220 as is for watch program.
motion's on the floor to leave the $220,000 as is. Any further discussion?
Mr. Chairman.
Mr. Daugherty.
Mr. Smith, it was my understanding that Watch was transitioning to more of a billable service to Medicaid, and they would actually be billing for Medicaid and producing revenue as a result of that, similar to Goshen Medical and some other providers.
They're doing that this coming year.
And I would ask that with them beginning that process of billables, that they reduce their dependence upon Wayne County to provide funding, and that they sustain themselves through the billables as they are currently transitioning to, is my understanding. So I'd ask that they be put on notice to try to wean themselves away from funds from the county.
Yes, sir.
Thank you, Mr. Chairman.
Mr. Chairman.
Mr. Mayo.
And also add to that, as we discussed earlier, about making a concerted effort to get some other municipalities to participate in this program.
Okay. Any other comments? I have a couple. As you know, we have really worked hard as commissioners since January in putting together the health assessment program to look at promoting health, better health, finding support groups, having classes, having groups, and we've done this. And I'm going to have to say this because so much has been said. We went to 220, we backed off to 110, we've gone back to 220, but it is so important for the citizens of Wayne County. That's why I'm going to make this comment, if you'll bear with me. The WATCH program is the Wayne Action Team for Community Health. That's what it means. And it is helping the uninsured live well. Not the underinsured, the uninsured live well. And this Wayne Action Team, as exposed to us by internet and news, so forth, this Wayne Action Team for Community Health, WATCH, pioneered the concept of free mobile medical units in North Carolina. The WATCH mobile unit is the only free mobile primary health clinic in the state, and it travels around Wayne County providing free primary and acute health care to our community uninsured. Each year, WATCH provides medical care to thousands of patients and dispenses more than $2 million in free medications. Wayne Memorial Hospital is the only local health care provider for a large population of uninsured people, and it is through the support of WATCH that we are able to improve access to care. WATCH also addresses the promotion of healthy behaviors through obesity treatment, which is something that Mr. Madden, Mr. David Madden, has advocated here not long ago at his meeting he had at the group meeting that we had. And the preservation programs in collaboration with the Goldsboro Family YMCA that we've just mentioned, but we did not mention the Wayne United Way. WATCH works to to prevent substance abuse. So that's going to help in this East Point issue that we had yesterday, and teen pregnancy that we've been talking about so much for the last couple of years in our community as well. It's the stories of cancer called early, and some of us know that well, managing diabetes and kicking the smoking habit that benchmark the success of our WATCH program. Follow up real quickly with health promotions, because it's Live Well with Wayne Memorial Hospital. At Wayne Memorial Hospital, we are firmly committed to improving the health of our community by revitalizing our approaches to disease prevention and health promotion, to demonstrate that we have taken a leadership role in providing extensive health care and health promotion services throughout our community. Now, you're on the board, Mr. Daugherty, and I commend you that you've rescinded, or you've taken that 110 back to 220. But with that, I would also hope that of what I have just read and what you have supported and what we have advocated, that EMS has done such a great job at providing a quick service to the citizens of this county to get every call to the emergency department, and that they do not charge us the $60,000 in linen cost that they're trying to call, tell us that we need to pay them in order to pay for the linen that they're putting on these gurneys for us to provide all this business that we're bringing them. So maybe that they will rescind that $60,000 cost, and we can save that. But getting back to the subject, the $220,000 is on the table. That is a motion, and that was my suggestion. That was my comments. Any other comments?
Mr. Chairman,
Mr. Cromartie.
to rise in support of that 220, I was just sitting here thinking about first time I remembered observing one of those vehicles in action. I was in Mount Olive with J.D. Evans, and he was giving me a verbal lesson and a visual lesson on the good that was intended for. So I think it's a dollar well spent. I know personally people who I don't think would make it all the way to Goldsboro to get treatment, but they access that service. And, you are right, it's for people who are really down there needing everything from blood pressure, diabetes, and all those kinds of things. So I congratulate you on reading that for us, so we'd be very aware. But it just reawoke the conversation that he and I had and the rationale that he gave for the early support that the previous boards have done for that. And previous boards are to be congratulated for that.
Thank you, Mr. Cromartie. Any other comments? Motion's on the floor that we approve the $220,000. All those in favor, raise your right hand. All those opposed? And that is unanimous. Thank you.
Mr. Chairman,
Mr. Aycock.
I have an item I think we need to address that has nothing to do with the budget. It won't take but just a minute to do it. We have had numerous meetings in the last 2 or 3 months, very lengthy meetings. The Sheriff Department has provided security for us, and some of these meetings have gone into 6 and 8 hours. I think we need to allow our security officers to at least sit down or get them a chair and put beside the door. We're all sitting down and they're standing there very patiently, and I appreciate them, but they put a lot of hours in standing at that door.
Thank you, Mr. Aycock. See if we can provide some chairs for you fellas. If you promise to get up quickly.
We want their legs rested, so if they gotta get up, they can move. Don't go to sleep.
Okay. Thank you. It is, any other items that you wish to bring up?
Mr. Chairman, three additional items, if I might.
Mr. Daugherty.
And if I could just group these together.
Yes, sir.
I move that we approve wages foster grandparents allotment of $5,000, communities and schools for $130,000, and Wayne Uplift in the amount of $40,000.
Motion's on the floor that we approve all 3 of these. Any discussion?
One question.
Yes, sir, Mr. Pate.
On communities and schools. Is City of Goldsboro providing anything to that?
We haven't had a request. Look at the file and see, sometimes they include that in their,
Well, the reason I asked that question is I know that the graduation teachers started in Goldsboro. And
Sure.
I think there's about 2 or 3 of them in the city now.
yes.
And I know they do a great job because I've seen the evidence of it over the years. It just seems like if they're not given, they should be part of that, since it does impact the city of Goldsboro.
I remember Selena saying that there had been conversations with City of Goldsboro in meetings,
She was going to ask.
She was gonna ask,
She was
yeah.
going to.
because we asked in our meeting, we said, you know, are they contributing?
I mean, somebody look at it as a county thing, but I think it's more than that. It affects
Well,
the city of Goldsboro.
I guess it's a reason it's called community.
That's just my opinion anyway.
Sure, sure.
Any other comments, questions?
Mr. Chairman,
Mr. Aycock?
I've got the Wayne Uplift in the communities and school. What was the third one?
Wages foster grandparents.
Okay. Thank you.
And if you can make that once a year at Cherry Hospital, when they have, what is that day called?
Foster
Foster
Grandparents Day.
Grandparents Day.
Luncheon, yeah, it's a nice event.
Please make that if you can, Commissioners.
Yeah, it's a very special event.
Very enlightening, very encouraging.
Mhm.
Any other comments? All those in favor of voting for all 3 of those, raise your hand. All those opposed? That finishes that up. Any other items?
Mr.
Mr.
Chairman.
Chairman,
Mr. Aycock and Mr. Kamar.
Have we already acted on the second item, Wayne County Farm Association? Have we?
We had recommended no changes.
Okay, all right.
Mr. Kamar.
yes, I would like to revisit the Mount Olive Airport.
Yes, sir.
I happened to have a conversation with the town manager and mayor of Mount Olive, and
Yeah.
the preliminary conversation they had here in the building with the county manager, and it sounded like at least 2 of the county commissioners, of which I wasn't one of them, but they went back and built their budget based upon what they had expected to receive. And the amount that's been cut, of course, in a little town like Mount Olive is, and a smaller budget than the Wayne County budget is, any dollar amount that's not received has an effect. And one of the things that I believe I remember in their budget is that they're giving a cost of living raise to their employees. I would not want to see a reduction in what they had expected to get for the airport if they funded everything at the level it was previously. Something cut into some good, I might cut the fat, but I don't want to see them cut the lean. I would also like to say that Mount Olive is a cooperative environment, and my calculator won't make this calculation, but I would just, out of curiosity, like to know what percent $40,000 is of 121 million. Is there any way you can give me that? What 5,000? What percent $40,000 is of 121 million dollars? It can't hardly be described on the calculator, can it? Because my calculator wouldn't generate the small amount that is against the total budget.
0.0033.
Yeah.
1/3 of 1%.
1/3
1/3 of 1%. 1/3 of 1%.
Mhm.
I would not want Mount Olive will budget be upset by 1/3 of 1% of the amount of the Wayne County budget. And I know that there's a lot of goodwill that is expected to happen between Wayne County and Mount Olive. I know there's some, at least a building or so in Mount Olive being used by EMS or EMT or somebody and also I heard yesterday that Mount Olive might be expected to handle some waste or sewer if all kind of projects are put out towards Grantham. So I would just not want Mount Olive to be overlooked, or Mount Olive to be given the idea that they are treated less than equitable, because the comment that I think I got from the mayor was that he did not think that the Mount Olive Airport was being treated equitably with the Jetport. So I lay that in front of you, since after some consideration a few minutes ago, we went from $220,000 down to $100 and some thousand, and then back to $220. I would just want to impress upon this board that we might want to reconsider funding Mount Olive Airport at the original request of $40,000, and therefore I make a motion for that to happen.
You're at the request, not, okay.
I see that it's currently it's projected to be funded at $28,000. The way I understand it, original request was $40,000. Is that correct, Ms.?
Yeah, they asked for an increase.
They asked for the increase that would have been at $40,000. And out of some discussion, they led me to believe that they got a favorable impression on a visit here as some of the discussions about the budget was taking place in a meeting that I wasn't at, but somewhere in the one of those last meetings that was here in the building. Mr. Brown, with two of the commissioners, and I was neither one of them. Who was in the, anyway, that's the impression that he gave me, was there was a favorable impression on the increase that they asked for. But having said that, based upon what I perceive as their needs in Mount Olive, I would like to say I would like to make a motion that they be funded at the $40,000 that they requested.
What was the original amount before their request?
That we have been funding at $33,281.
For how long?
3 years.
Yes.
Actually 5, but the 4th year back, it was, say, 30,000.
That's right.
Okay, so you're saying we've been funding $33,281 for 3 years, or for 5 years?
Yes, sir. This 1 year had to be in 30,000 instead of 33,381.
Okay. And they have asked for a $40,000 increase. Well, they've asked to increase to $40,000.
Right.
And we went over this yesterday, and the price or the expense for Mount Olive Airport was voted on at $28,000. Is that what you're saying?
Yes. That's what, well, when you look at this dollar figure.
Is that what we did yesterday, Ms. Holt? Did we vote for $28,000?
You didn't vote on this yesterday.
We did not vote on this yesterday. Okay?
We discussed it.
We discussed it, but we did not vote on it.
Last week in the work session. Yeah.
Okay.
But no changes were recommended.
All right, so motion's on the floor to motion's on the floor to provide Mount Olive Airport $40,000 instead of what they've got last year. What was their last year?
33,281.
33,281, which is an increase of what percent? They're asking for an 8% increase from 33,281 to $40,000. And the motion's on the floor to provide them $40,000. Any discussion?
Mr. Chairman.
Mr. Aycock. Mr. Mayo. Y'all need to just switch. You're such good friends, and when I see both of you, I'm sorry.
That's all right.
I'm sorry. I got to quit doing that, I'm sorry.
What did he call you this time?
Mr. Mayo. Sorry.
Thank you,
Wayne.
Mr. Chairman.
First names would be better.
Okay.
But not professional.
That's fine.
Mr. Mayo.
Yes, in addressing this, we need to remember a couple of things. Really can't compare the Wayne County Jetport to the Mount Olive Airport because the county does not own the Mount Olive Airport. Is that correct?
That is correct. You own some of the land out there.
Okay. So what's been given over the years has been a cooperation and a collaborative effort to try to do for both airports what we can. So in view of that, Mr. Chairman, I want to amend Commissioner Cromartie's motion to go back to, we can go back to the original, what's been funded over the last 2 or 3 years of $33,281.
Okay, there's an amendment then that we funded at $33,281. Any discussion?
Mr. Chairman.
Mr. Cromartie.
The Mount Olive administration, town administration, and folk who are concerned with, and I think I'd like to use the word equity versus equal, is that they are providing certain things to the Mount Olive community that is provided at the Jetport. They have a lengthy article and paperwork to justify what they contribute to the economy, and the industrial park is down there and what they hope to grow towards. I'll repeat again, sometimes you have to look at going on and helping folk do what they want to do to get to where they perceive to be. And I visited both places, and I'm very impressed with the Jetport. But I say to you all, Mount Olive feels as strongly about their airport as anyone could feel about the Jetport in the north. So sometimes we just need to be equitable and maybe not worry that some equal outcome doesn't take place this year that might sway one to say the Mount Olive Airport does not deserve to get what the Jetport is getting. I would not want that impression to be given in the southern part of the county. So I maintain that we need the $40,000.
Any other discussion?
Mr. Chairman.
Mr. Mayo.
That certainly is not the intent in any way to minimize the importance of the Mount Olive Airport. The key here is that going back to the funding over the last 2 or 3 years that we as a county feel like is appropriate in a year that we're cutting most budgets, but we're going back on the amendment to get back to the $33,281. I still maintain that's what we need to do, Mr. Chairman.
Any other comments?
One last comment.
Mr. Cromartie.
If we have not raised anyone else, then I would say we cannot afford to give any increase to Mount Olive. But unless I stand corrected, we have someplace on this discussion and budget given someone an increase. So if, we can talk about going back to some original budget, but if we haven't given any other increases, I'll say leave it at what it was last year. But if we've given any increases, then I don't see that as in my mind, it's not a valid rationale for just leaving it at what it was last year versus helping them to accomplish the goals that they feel like they will with the 40,000. Thank you, sir.
Yes, sir, Mr. Cromartie. Any other comments? There's sometimes I wish I didn't have to make comments, but when you're involved as much as I have been involved in, you have to, someone asked me one time, what are you going to do with what you know? Well, you have to tell it. For the last 4 years, I've attended the meetings at Mount Olive Airport with Mr. J.D., and I've been a part of watching the grants be approved. And to be honest with you, Mr. Camardi, if it were not for the grants, the Mount Olive Airport would not exist. The grants come through at such a great time, the timing. They do the best they can. It is a small airport, but we have stuck in there with a industrial park right across the street with signage, pushing a building that's been sitting there for nearly 10 years, pushing that with the airport. Whenever the RPO came in and wanted to do a transportation improvement plan for Mount Olive, the airport was made a vital part of the mission for that transportation to work, not only just from a company like Mount Olive Pickle that everyone knows about there, from there over to the west to Highway 117, but also to connect east to the airport, and how important the industrial park was to the airport, and how important height restrictions were with water tanks and towers and things of this nature as far as Mount Olive is concerned. So the commissioners in the past, and I know I have, the meetings that I have sat in with the Mount Olive Council are very attuned and very sensitive to the airport. But again, this year, because of funding, I have to go along with the amendment that Mr. Mayo has made, that sure, the reduction was nice, but trying to get those down for a purpose, and that purpose will come after lunch. But here again, the amendment is that we move to $33,281. Any other discussion? Being that it's the amendment, we vote on it first. All those in favor of the amendment of $33,381, raise your hand. All those opposed? That would be 5-2. The two opposition be Mr. Bell, Mr. Camardi. Now we'll vote for the motion. The motion is that we allocate $40,000 to
Mr. Chairman, that was just amended.
to $33,000, and that passed.
But
But
that's the motion.
Does that cancel out the motion of $40,000?
It makes it the motion.
That is the motion now, so you vote on whether or not to expend $33,281.
I'm sorry, I used the wrong figure. I said 40,000. I meant the, I'm sorry.
281.
Okay, the motion is that we take $33,281 and make that the motion for Mount Olive Airport for 2013-14. All those in favor of that motion, raise your hand. All those opposed? 5 against 2. 5 for, 2 against. Any other?
Just as a light moment for a moment, Mr. Chairman, if the chairman made the $40,000 motion prior to being corrected and it was voted on, what do you do with that?
Remind you that.
Remind me you made a mistake.
Well, that you're not that it's made a mistake, but that that's not what's actually before the board.
All right. Okay, I just, a point of wondering.
That's why we have an attorney.
Lots of ears and lots of eyes.
Well, I assure you, Mount Olive is listening.
Any other items? We will adjourn for lunch.
Recess.
We will recess for lunch. It's 10 minutes to 12. We will come back, and we will start at exactly 12:30. And we will conclude with the Wayne County Public Schools